حجابي حياتي أحب الحجاب كصوم صلاتي به العمر طاب حجابي جمالي وللخلق راية سباق المعالي وهذه الحكاية
will be taken and be broadcasted in others fora. The second objective is also so that we can be able to, maybe this should be the beginning of some sort of collaborations. You see people from different walks of life, we want to collaborate at organizational level to be able to still further make inputs in the prevention and the control of cancer. In our midst, he's representing the president of the Nigerian Cancer Society. Sir, you're welcome to the high table. He's a consultant obstetrician and gynecologist with much interest in cervical cancer, and he also has an NGO on control of cervical cancer. I'm sure he will say one or two things when it comes to his podium. The next person is Dr. Basira Lawal. Dr. Basira Lawal is a consultant, radiation and clinical oncologist working here in National Hospital, Abuja. The patients you see from beginning till the end are cancer patients. So the whole specialization is on cancer. I'm sure she will have a lot of things to do. You're welcome, Dr. Basira. Then Dr. Hannatu Ayuba is a senior registrar in National Hospital in radiation and clinical oncologist. And in addition, she's someone that is very passionate about cancer advocacy. You are welcome, Dr. Hannatu Ayuba. Then with us, we also have our mother, Dr. Yelwa, who is not just a Form 1 person, but also a cancer advocate. I'm sure at the organizational level of Form 1, she has done a lot towards awareness on cancer. And even today, she is going to give us some talk on cancer. Then the next person, so I forgot your name. Okay, Architect Zubairu Usman, who is our father, or let me say chief host here. He has already given us a welcome address, but at the same time, this is somebody that, in addition to that, he has personal experience with cancer and is going to give us also a perspective on cancer. Then we also have Dr. Salisu Ismail, a consultant cardiothoracic surgeon who was the past chairman or president of the Islamic Medical Association of Nigeria. He is currently with Federal University, Duse, and a consultant with Rashish Shekoni Teaching Hospital, Jigawa. So you're welcome. And last but not the least is Dr. Mariam. Dr. Mariam is a senior registrar. Dr. Mariam Abdullahi, she's a senior registrar in radiation and clinical oncologist in National Hospital, and also one of our sisters. One of the good things here is that we see that the Ummah, we are developing resources in the cancer space, so we need to utilize them maximally so that we can be able to benefit the Ummah. And that's the reason why we parade ourselves today, so that we can be able to talk to you on cancer. So the presentations will be as brief as possible, inshallah. And first, we want to honor the president of the Nigerian Cancer Society to come and give his goodwill message before we proceed further.
Assalamu alaikum wa rahmatullahi wa barakatuh. I congratulate the MESH and sister organizations for putting this together. I'm Dr. Ishaq Lawal, a consultant gynecologist, executive director of End Cervical Cancer Nigeria Initiative. I'm here on behalf of the president of Nigerian Cancer Society, Dr. Adamu Al-Hassan Umar, who is unavoidably absent. Luckily for me, because it's a pleasure for me to be here, to be standing in his shoes, even though the shoes are big enough for me to stand in. But currently is attending the program in Rwanda, also on World Cancer Day. So I bring you good tidings from him, and he says I should extend his greetings and appreciation and willingness of Nigerian Cancer Society to collaborate and support the good work that the Muslim community is doing. World Cancer Day is celebrated globally on the 4th of February, And the theme, the global theme for World Cancer Day is closing the care gap. And I can see that the theme for this organization is cancer care, the role of Muslim community. So I will say the role of Muslim community in closing the care gap. And as the MC said, one thing will be collaboration. It is sad that when it comes to activities, we find out that in terms of technical output, the Muslim community are largely absent. And look at the array of technical people that we have. We should, if there's anything we should take home from here, is to come together and ensure that what we have, we can use to the benefit of the Muslim community, so that we can increase our visibility in the area of cancer care. And lastly, just to round up, is that we always say cancer screening saves lives. I, based on experience, say screening does not save life. It sounds controversial, but that is the truth. It is only treatment of the screen positive cases that saves lives. So while we are thinking of the collaboration and activities we are going to do, we must include support to be able to treat patients that are PICT positive. Until we are able to treat patients PICT positive, we cannot save life. May Almighty Allah help us to save lives. Thank you very much.
Thank you very much, Dr. Isaac Lawal. Actually, I have heard about him. I've even read a lot of their release, but I never met him until this program, and I told him that I'm impressed with what he do, and will inshallah collaborate from there. And he has also expressed his willingness to collaborate with the Islamic organizations towards this prevention and treatment, inshallah. So the next aspect is that we are going to be taking maximum of 10 minutes per presenter to download different aspects of this cancer. Please listen with rapt attention, and we hope to be able to answer your questions by the end of the day. We try to make it very short so that the attention span will not be lost and a direct message can be able to send from different aspects. So the first aspect is we want to just discuss what is the burden of cancer globally in the sub-Saharan Africa and Nigeria. I don't know if that slide can be made available for the viewers to be able to follow the presentation, and I'm the one that is going to make the presentation actually, and we have tried as much as possible to remove the medical jargon so that we just speak in the language that you can understand. Cancer, you say cancer, cancer, cancer. Cancer is not just one disease, it's a group of diseases that can affect any part of the body literally. And what makes cancer different from other type of diseases is that cancer will start from one place and spread to another place that is not related to where it started from, making it very difficult to treat if not addressed at the appropriate time. So the causes of cancer up to now are largely unknown. However, there are a group of things that add together to cause the cancer. We call it risk factors. Only very few cancers have direct causes that we know, for example, lung cancer, and but generally most of these cancers we don't really have that direct causative agent, but we have a group of things that come together. We call them risk factors. This will be explained inshallah in the subsequent slide. Then another thing I want to mention is that cure of cancer is possible. However, just like Dr. Lawal said, when you screen early, you detect it early, and you institute appropriate treatment. So cancer is not a death sentence. Are we together? If the appropriate thing is done. And then the other thing we want to know about cancer, no one single person will just sit down and say he can manage cancer patient from beginning till the end of the journey of the cancer. If you come to the hospital, you see nothing less than 4 to 5 different subspecialties of doctors managing different aspects of the cancer. So let no traditional healer take you to one corner of the room and be giving you medication and say that he wants to treat your cancer. Globally, I just want you to appreciate this. Every year, about 20 million new cases of cancer are diagnosed. Meaning, if we take from maybe 2013 to 2022 now, which is 10 years, 20 million. 20 million, 20 million. In 10 years, how many million cases are we diagnosing every year? 200 million. Every year, 20 million cases are added to the burden of cancer that is already existing. That's very huge globally, isn't it? And then about 10 million people are dying every year from cancer. Meaning in the same 10-year space, 100 million people globally will have died from one form of cancer or the other. This is really, really very huge. When we come down to Nigeria as a country, we see that Nigeria will have about 125,000 people affected every year. New cases, not those that were seen last year that are still surviving. No, new every year you are having like 125 new patients diagnosed, and then we are having about 78,000 people dying from cancer every year. That's very huge. If you just divide 78,000 by the 36 states we have in Nigeria, that means in every state we are having about 2,000 people dying from cancer. That's if it is evenly distributed every year. So it's something that affects us greatly, and then it's something that we should all come together and rally about. These slides, please next slide. The slides will be made available to you. I don't want to disturb you with so many jargons, but it is important for you to know that the commonest cancer globally are breast cancer, then lung cancer, then prostate cancer, in that order globally. In the female population, it is breast cancer that is first, then followed by colorectal cancer, that's the cancer that affects the intestines, followed by lung cancer. While in the male population, lung cancer is the commonest globally, followed by prostate cancer and colorectal cancer. When we zoom down to sub-Saharan Africa, that's we know what sub-Saharan Africa is. Nigeria is part of the sub-Saharan African country. We see that the distribution is slightly different from what we see globally. In sub-Saharan Africa, breast cancer is the commonest across most of the countries, followed by cervical cancer. In some sub-Saharan Africa, it is cervical cancer first before breast cancer. But when you even combine the population together, you see breast and cervical cancer are the commonest cancers, even in the whole population. So you see, the commonest cancer that affects us here in sub-Saharan Africa is something that is relatively biased towards women. And that's one of the reasons why it's important that women are given special education on cancer. So, what is the burden of cancer? The emotional trauma alone of even just knowing that you have been diagnosed of cancer is something that is huge to somebody. And then not just the person, but the family and the loved ones. Once a woman is diagnosed with cancer, it's a huge burden on her family. Her husband, her children depend on her. When an aged man that's supposed to be enjoying his retirement now is now diagnosed with prostate cancer, it's a huge burden on his children and his spouse. How does this man cope with this particular cancer? Another huge burden of cancer is we have the loss of productive time. Now, somebody that is always active doing one or two things will now have to spend a lot of time in the hospital, leading to a lot of loss of productive time that will have been used to do some other things. Then you also have a lot of constraint on individual and the family resources. Cancer treatment is very capital intensive. Radiotherapy, surgery, and the other things. It's not something that you just go to hospital today, they admit you tomorrow, and next tomorrow you are off. It's something that sometimes the treatment takes up to like 6 to 8 months intensively. You are moving from one phase of treatment to the other. So it costs a lot to treat cancer. So it causes a lot of burden on the families and the individuals. And definitely it can reduce somebody's capacity. If before you are somebody that's active can work for 6 hours, when you're having the cancer, you may be limited to 1 or 2 hours. If not, if it is more advanced, you may be able to be bedridden and be depending on people. It causes also a lot of cost on government. The government have to be providing these facilities to be able to be curing cancer. Money that if the cancer was not available will probably be used to solve other problems. So we have a lot of challenges of cancer management in this our space in Nigeria. And please, I want you to listen to this particular slide. The first one is our people present late. In Nigeria, patients present late, but our people particularly, they present late. A woman that comes with breast lump, by the time she's coming to the right specialist, it's already advanced. She will have gone to one chemist, one traditional healer, one Islamic medicine in quotes. I don't know whether I put it in quotes so that to talk about that Islamic medicine. People using Islam to deceive other people. So by the time the patient comes, he's presenting late with advanced disease. And when the person comes to the hospital, you cannot do anything. They'll say, you see, that's those that don't understand outside. We told you not to go to the hospital. These doctors kill cancer patients, and then the patient will die in your table when you cannot do anything much. Meanwhile, the main underlying factor is that they failed to present when appropriate and the right treatment was not instituted on time. Then a lot of people are not even aware of cancer. Many people, the first time they have to understand really what cancer is when somebody that is close to them is afflicted with cancer. That's when they really have to start on that's when they start the journey of even understanding what cancer is all about. I'm not saying, have you ever had about breast cancer, yes or no? No, that's what I'm saying. But what is breast cancer? Who are the people that are likely affected? What are the risk factors? What can I do to prevent breast cancer? What can I do to screen? Most of the women we have, even the educated ones, don't have that good knowledge about cancer. So awareness is very poor. That's one of the reasons why we are coming here to talk today. And I'm sure Dr. Elwa, our mother, will talk about what can we do as organizations to be able to spread this awareness to the people appropriately. They also have lack of community-based screening. If you just carry 1 or 2 persons and you're screening, it will not control cancer in the society. We have to have the whole community being screened. Those that are eligible to be screened, that's when we'll be able to have appropriate control. And I'm sure there's some talk about the screening that will be made possible. They will also have lack of health insurance coverage on cancer patients. More than 90% of our cancer patients are not on any form of health insurance at all. So it means that they will have to use their pocket money to pay. So just imagine a woman that will have to do 6 courses of chemotherapy. One cycle with just a moderate is about 40,000. If she's a teacher, earning 30,000 naira per month, and she has to be doing this chemotherapy every 3 weeks, and her husband cannot support her, her community cannot support her. You can just imagine the huge burden. We have not even come up, and we have not even talked about a radiotherapy that can cost up to 800,000 naira for the whole thing. Where would you get the money? These are the real realities on ground. Even those that are covered by the insurance, only very few cancer care is actually covered by the insurance, so they will still have to use their money to pay. They will also have inadequate health workforce in the cancer space. Not enough people to cover all the people in the rural area. For example, in Buso, where I am like this, I'm the only oncologist in the whole of the state. Even in the so-called Abuja, we are talking about how many oncologists do we really have? In the whole, this is the federal territory, Abuja. We don't have enough oncologists to cover all the suburb of Abuja. Definitely we don't. Talk more of the other rural areas that we are talking about. And then patients spend a lot. And then the other thing that is actually affecting us is we are competing with traditional medicine people towards cancer care. If the traditional people can cooperate and understand that this cancer is not their disease, anybody that comes to them, they send them appropriately, they will have helped to sort out a lot of things. But patients will come to them, they will give them all barrage of traditional medicine. By the time it's advanced, they'll push them away as if they never even met them, and then they will now come to us. So this slide is just to open the discussion on the cancer, and then I'm going to give time to the other presenters to be able to have their say, inshallah, on the cancer talk. Thank you very much for your time. I would like to call on the next presenter, Dr. Hannatu Ayuba, to make her presentation. She's going to be talking to us about the causes. She's going to be talking about the symptoms and signs of cancer. How do you know that these symptoms could be cancer, and what are you going to do about it? Dr. Hannatu Ayuba, welcome. Please, the slide on symptoms.
The process is a process which takes a lot of steps and time in making the cell abnormal and destroying nearby structures and distant structures of the body. This stepwise process may take time with some associated symptoms which are noticed but ignored, or presumably managed with common medications for common symptoms of common diseases in our communities. So in the low middle income countries, please next slide please. In the low middle income countries in which Nigeria belongs, there is a very There's a generally low level of early screening and early detection of diseases, of cancer conditions. So generally, majority of our cases come in advanced. And with these advanced stages, at this point, there is less treatment options for the patient, more suffering, more morbidity, more expensive treatment needed, and then there's less probability of survival. And that is why we emphasize early diagnosis. Early diagnosis, which has 3 components. And this includes being aware of symptoms of different cancers. Second, access to clinical evaluation and diagnostic services. For this access, I'm talking about going to see your specialist doctors, not just going to a private facility where there's a doctor that will see everybody. You are entitled to have that specialist care, that specialist management, because cancer care is a multidisciplinary and multimodality kind of management. You are supposed to get the benefit of all the different specialists involved. Then thirdly, and last but not the least, timely referral to treatment services. It's not just screening. You can screen, that condition has been caught, but if you don't institute treatment quickly, this will not give us good patient outcomes. Next slide, please. So symptoms and signs are common medical terms that we use and we interchangeably use every day. Symptoms are perceived by the person suffering from that condition, and signs are objective findings that can be seen or measured by a loved one, by a family relation, or the healthcare provider. So most times we use them interchangeably, and when the patient comes in, that patient may tell you all the complaints he has together with symptoms and signs. So here I want to raise awareness such that we have an idea of these symptoms. I'm not trying to scare anybody here, but that awareness is key and information is power. So for most of the malignant conditions, I just added different ribbons to just show. I don't want to scare you with any gory pictures, it's just for awareness. So there are constitutional symptoms. These symptoms are seen to be present in most malignancies, and these include persistent fatigue, abnormal swellings or lumps in the body, weight changes unintended, most times loss of weight, frequent fevers and infections, night sweats, persistent pain, and skin changes. Next slide, please. Thank you. So for breast cancer, the symptoms, stroke signs include having a lump in the breast or armpit, lump in other parts of the body, unusual nipple discharge, bloody discharge, changes in the nipple, how it looks, skin thickening of the breast, redness, orange, peel-like skin, changes in the breast, pain or discomfort, headaches, that's in advanced conditions. Patients will have headaches, bone pains, inability to walk. However, there may be no complaints. This may be caught as an incidental finding when a patient goes, when a woman or a lady goes for screening, or when she goes for other investigations for other conditions or complaints that she may have. Next slide, please. There are symptoms for cancer of the uterine cervix, that is the mouth of the womb. This patient may have no symptoms. There may be abnormal vaginal discharge. There may be abnormal vaginal bleeding, for example, after intercourse, in between periods, having very heavy menses, or bleeding after menopause. Then the woman may have pain during intercourse, changes in bowel movement, pelvic pains, frequency, like going to urinate frequently, difficulty with urination, back pains, loin pains. This is in advanced cases. The woman may have neck swellings and blood in urine or stool. I'm not trying to scare us, but these are all symptoms and signs that you may notice or your loved one may notice, and this should prompt you to seek for clinical evaluation. Next slide, please. For lung cancer, the individual may complain of chronic cough, which worsens progressively, shortness of breath, wheezing, bloody sputum, weight loss, which is unexplained. She's not dieting, she's not going for exercise, she's not doing anything. Fatigue, feeling always weak. Pain in the back, swollen lymph nodes, having seizures or convulsion. Yellowish discoloration of the eyes and skin. For lung cancer, we are beginning to see it so common in women now. Some may tell you they have asthma. They've been managing it for 10, 20 years, but they've never seen a pulmonologist. They've never seen a specialist. So we are trying to raise awareness that please seek for clinical evaluation. Try and see the specialist. It's your right. You have the right to good management. Next slide, please. Then for cancer of the prostate, you can see it under the bladder. This is in men as they age. The individual may have no symptoms, or patient may have difficulty with starting urine, or having steady stream of, or not able to have a steady stream of urine when he's urinating, going to toilet frequently, and even if he goes and comes back, he still feels he has not voided enough, there's still urine in the bladder. Having urgency before he goes to pee, immediately he feels like he wants to pee. On the way to the toilet, urine starts to dribble and drop. Leaking urine even when he comes back from urination, or not even able to urinate. Urine retention. And some may just have problems with maintaining erection, erectile dysfunction, blood in urine, and pain in the bones. Next slide, please. And in advanced cases, inability to walk. Then for skin cancer, this is an image of, this is an example of how skin cancer looks like. It's not to scare you, but it's to raise awareness. We see such kind of images in the market and many other places. We should be aware of these symptoms and signs, and we should help our loved ones, our neighbors, our friends that have such conditions to go to seek specialist attention. The individual may just have a small bump on the skin or a new growth that he or she may have noticed, changes in a skin mole or a skin lesion that the patient may have had since from birth, changes in color of the skin, persistent skin wound or skin ulcer, having swollen lymph nodes in the body, having a non-healing wound on the skin, bleeding, excessive fluid discharge from that skin, from that wound with smell and pain. All these are pointers to seek for specialist evaluation. Next slide, please. Next slide. Thank you. Then for childhood cancers, the child may just have a lump in the body or swellings, may have weight loss, fatigue, loss of energy, changes in vision or headaches, early morning vomiting, changes in hearing or in the speech, having speech problems, frequent vomiting, paleness of the palms and soles of the feet. Child may develop limping or pain in the joints, may have fever, pain. Such are symptoms that we should not just cover up. Take paracetamol today, take paracetamol tomorrow. We should try and see the specialist. Next slide, please. Then for cancers of the gastrointestinal tract, that's of the intestine, stomach, all the way to the rectum or anus. The individual may have persistent fatigue, nausea, change in bowel habit, intermittent diarrhea and constipation, change in stool consistency, abdominal pains or cramps, swelling, blood in stools, having stools like colta, very black, yellowish discoloration of the eyes, and in other cancers there may be bloating, difficulty swallowing, vomiting, blood, sometimes with persistent body itching. Next slide, please. Then for head and neck cancers, the individual may have persistent pain in the face, headaches, persistent oral wound or sores, ear pains or swelling, loss of vision or changes in the eye of the individual, maybe a child, maybe an adult, bleeding through the nose or ear, mouth or eyes, having nasal blockage or change in voice, persistent noise in the air, pain in the face, ear or any part of the face, discharge, persistent toothaches or falling off of the tooth, rashes in the tongue, and facial changes. Next slide, please. Then for cancers of the blood and lymphatic system, that's the leukemias and lymphomas, The individual may just have persistent fatigue. Over time, weight loss, frequent infections, bruises on the skin as if he has been hit and becoming darker. Easy bleeding, mouth ulcers, bleeding gums. Some may just be spontaneous, some may be when the individual is brushing. Swollen lymph nodes, weight loss or weakness. Next slide, please. So when such signs and symptoms are present, please do not panic, because there are other more common conditions that may have this kind of symptoms too. However, you should not just keep treating a symptom for a long time. It goes, it comes back, you keep going back. You should go to a bigger hospital where there are specialists, where you will be screened, you'll be checked, and you undergo baseline standard investigations. We also seek that we should be supportive, because sometimes it may even be a family member that will notice a sign in his relative's body. Be supportive. We should not mock or shame our relatives that have one or two symptoms and are battling with that. We should be supportive and encourage them to seek for specialist care. Then we should also encourage our relatives or people that have such signs and symptoms to seek for appropriate clinical evaluation and diagnostic services, and also ensure early referral for oncology care. There are now specialists in many parts of the country. You can inquire, you can ask, go to hospitals that have specialists and see them. It's your right. You deserve to be reviewed by specialists so that you get better outcome if there's any condition worrying you. And then follow up care diligently. We should also encourage follow up. Sometimes some individuals are treated for malignancies, they go to the villages and they never come back. Encourage that your relative that has a problem that has been managed to go for follow up. Sometimes there could be recurrences. Sometimes when these follow ups are instituted, you're able to catch the disease and manage effectively.
Thank you very much, Dr. Hannatu, for your presentation. Please, at this point, we would like to make a small disclaimer. Not every symptom you feel that you will now say, they have told us about it, and then you have to disturb yourself so much. There's what we call medical student syndrome in those days. By the time you go for a lecture and they tell you one particular cancer and the symptoms, when you go back to the hostel, you will be feeling as if those symptoms are existing in your body and you will just be unnecessarily worried. So we are not saying that everybody has cancer always, but we are trying to say you have the knowledge. When anything comes to you or your relative, you can be able to properly guide. Please, are we together? Even if you see a breast lump, it's not a cancer. Until the oncologist, the specialist diagnose and say it's cancer, it's not cancer. What we are saying is, don't take any symptom you see for granted. Go and consult what? The specialist. And at the same time, don't make this knowledge to come and be disadvantage to you that it will disturb your life, and any symptom you see, you are just off balance and you continue to be in one type of anxious state. Our younger ones, our future generation, some of them have, because of this World Cancer Day, they made some small research about cancer, and they want to come and showcase their knowledge and their brilliance on this cancer. So we'd just like to take a small interlude of 3 to 5 minutes so that we can be able to hear them and possibly bless them, and from there we'll capture them and say, these ones are the oncologists of the future, inshallah. So students of Esteem International College, Esteem Learning Center, sorry please. Students of Esteem Learning Center, please quickly come forward to...
Assalamu alaikum wa rahmatullahi wa barakatuh. Ahlan wa sahlan wa marhaban bikum. Barakallahu feekum. What are you all thinking about? Cancer? What is cancer?
Cancer is a creeping killer, though just a trial. It takes a lot from your body and soul. It is a trial from Almighty Allah.
Oh, but there are a lot of things cancer cannot do. Yes, cancer cannot cripple love. Cancer cannot shatter hope. Cancer cannot destroy peace.
Yes, cancer cannot kill friendship. Cancer cannot suppress memories. Cancer cannot silence courage. Cancer cannot invade the soul.
Cancer cannot steal eternal life. Cancer cannot dash our hopes as individuals. Alhamdulillah, cancer can't conquer spirit. As Muslims, we do not despair. May Allah heal all our brothers and sisters suffering from it. Ameen. Alhamdulillah. والصلاة والسلام على رسول الله وبعد فهذه رسالة لكل من ابتلي بمرض السرطان واشتد عليه الألم أبشر بكل خير من المولى عز وجل اعلم أن ما أصابك ابتلاء من الله فأبشر بجزاء صبرك ورضاك واعلم أن الله لا يضيع أجر المحسنين.
May Allah SWT reward and bless you all, and your parents and your teachers who have guided you through all this journey in learning. So without wasting much time, now that we have appreciated the symptoms of cancer, so please, we are going to make all the slides available, please, so that I can also be able to share and also be able to follow the knowledge. Now that we have understood what the symptoms are, now we are going to talk about what causes cancer. Do we know all the causes of cancer, or what do we call risk factors of cancer? So I would want to invite Dr. Mariam Abdullahi to come forward to talk to us about causes of cancer. Those things you think cause cancer, do they really cause cancer? And those things you are not aware of that cause cancer, he's going to tell us more. Dr. Mariam, you're welcome.
So, because of the time factor, I think I will start before she gets to project. Well, my presentation, when I saw it, I was like, okay, this is a very short presentation. What causes cancer? Nobody knows. So I'll just come and say, well, I don't know, and go back and sit down. Because Dr. Omar already told us that we really don't know the cause of cancer. In majority of cases, there are some very few that we do know, but in majority of cases we don't know. So most patients, especially those that are afflicted, always ask us, how come I have cancer? What caused this my cancer? It's a very difficult question to answer, because the cause of cancer is really not known. To explain, however, the process of development of cancer in some people. Next slide, please. For us to really understand the process of development of cancer, I want to assume that nobody in this hall has any knowledge of science. I'm going to go back to the basics for us to understand the process of development, but it's going to be very brief. So, the definition of cancer is a disease resulting from uncontrolled growth and the division of abnormal cells. But then, what are these cells? Is there a pointer, please? Okay. So, the picture of normal cells up there shows some cellular structures that divide in an orderly fashion. When we look at the cancer cells, we see that they are dividing, multiplying. When I say division, it means that they are multiplying and growing in a very disorderly manner, in a very chaotic manner. Next. So, like I said, this cell forms the basic unit of every living human being. Every living thing in the world, When I'm talking about cancer in human beings, so I'm going to talk about the structure and organization of the human body. We have all eaten chicken, and we know that the chicken has lungs, heart, skin, bone, muscle, everything. So all of these structures are made up of cells. The easiest way to understand the cell, next slide please, is to think of it like an egg. Actually, an unfertilized egg is a cell. So the cell has a structure that we call the nucleus generally, the cell membrane, and what we call the cytoplasm. The beginning of cancer lies in this part called the nucleus. That is the middle part there. Thank you very much for this. So this middle part is the nucleus. It contains something we call the nucleolus, which contains the chromosomes. The chromosomes contain the hereditary, all the regulatory information in the body. They regulate every single thing from our skin color to our voice, to our height, to how our cells divide. Next slide. Okay, I can. This chromosome further contains something we call the DNA. Full meaning is deoxyribonucleic acid. Okay, so let me continue before they're able to get back the projector. This control sometimes can become abnormal. The control of how a cell divides, how a cell grows, how it grows in an orderly fashion, what determines what it dies, when it dies, and what determines when it is abnormal. There are some factors that we call risk factors that can the reason why we say that we don't know the cause of cancer is that in some people, when they're exposed to certain factors, they develop these abnormalities in the growth and division of these cells, which is the beginning of cancer. While in some people that are exposed to the same factors, they don't develop it. So, but there are some factors that we realized are commoner in certain people that eventually develop cancer. So we call them risk factors. These risk factors can be divided into the basic point I was trying to make here is that the cell is the beginning of every cancer. It has a structure in it that is not moving here. It has a structure in it. The next slide. That determines how the cell divides and multiply, and when there's any abnormality in this structure, it can divide abnormally. The reason why we say that we don't know the cause actually is because we don't know exactly what makes this division abnormal in some people, while in others the division is normal. Next slide, please. So when there is, just back again to the first slide, when there is an abnormal division, the cancer cells multiply rapidly. They don't multiply with any form of structure or order, and then before you know it, they become what we see outside as the tumor, that is a swelling. Next slide, please. Now what research has found out is, some people took their time to look at this, who are these people that develop cancer? Is there anything in their lifestyle, in their genetics, in their behaviors that is different from those that don't develop cancer? So that is where we came up with the concept of risk factors. There are some risk factors that are what we call modifiable, those that you can influence, those that before you develop cancer, you can take up the habits, healthy habits, and not develop cancer in the future. So those risk factors that have been linked to causing cancer include the most common one, smoking. I must mention here that every type of cancer has its own set of risk factors. Not all are common to all, but the majority of these risk factors are common to most of the cancers that we know. So smoking, alcohol, obesity, poor diet, unprotected sex, excessive sun exposure, sedentary lifestyle, all these have been associated with development of cancer in the future. Why do we call them modifiable? You can stop smoking. You can stop taking alcohol. You can work on your weight. I can work on my weight and reduce it. Sedentary lifestyle, even if you all work in the office for how many minutes, you can take that break of 30 minutes to take a walk and come back. Poor diet, you can decide to go green. You can decide to make sure that everything in your fridge is green. Unprotected sexual intercourse, alhamdulillah, we are Muslims. This is definitely not part of our lifestyle, especially even the alcohol too. Excessive sun exposure, those people, this is especially important in albinos. They can decide to cover themselves during the day, wear long clothing, use their umbrella during the day to prevent development of cancer in the future. Next slide, please. Well, there are those factors that are not modifiable. For some people, they have the genes that make them tend to develop cancer in the future. It doesn't mean that they must develop cancer. So people who have a mother or a sister or any relative that has had cancer have an increased risk of having it. It doesn't mean that just because your mother or your sister or your aunt has had cancer, you must develop it. It just means that you are at higher risk. But you can't change that fact. That is why we call them non-modifiable. Your ethnicity, some cancers are commoner in some particular ethnic groups than others. For example, even the cervical cancer we have been talking about so much is definitely commoner in the northern part of the region of the country than in other parts of the country. Family history, I've mentioned that your race, some cancers are commoner in particular race. Age, we're talking about prostate cancer. Prostate cancer tends to develop later at an advanced age. Next slide, please. Well, we can't finish this presentation without talking about cervical cancer. We just came out of January, which is the Cervical Cancer Awareness Month. The reason why I brought up cervical cancer here, it is one of those malignancies. When I say malignancy, I mean cancer, the cause has been identified. One of those malignancies that has features of any presentation even before it becomes cancer. One of those malignancies that even when it becomes cancer, it can be treated fully. One of those malignancies that has vaccines available to prevent that virus from even setting its foot in the cervix in the first place. So the question now is, if we have all these things, we know the cause of cervical cancer, we can screen for it, we know the symptoms, why are we still suffering from cervical cancer? I think it's our collective responsibility, the Muslim Ummah, to make sure that cervical cancer is eradicated from the northern part of the region where it has the highest prevalence and eradicated from the world collectively. Next slide, please. In conclusion, although most cancers, majority of the cancers they cause remain unknown, we definitely have risk factors. And those risk factors, most of them are things that we can do something about. So it's our responsibility to protect ourselves from cancer. Thank you.
Thank you very much, Dr. Maria Abdullahi, for your presentation on prevention. I said prevention on risk factors and causes of cancer. I hope we're able to learn one or two things. And then, interestingly, she tried to link the two programs we're having together, which is the World Hijab Day and the cancer awareness, where she said covering may be able to help to reduce the exposure to sunlight. So if there's anything you can add to the importance of hijab, is a protection and covering that can be able to also reduce exposure to sunlight and possibly prevent some form of cancers. So alhamdulillah for the time well spent so far, and I don't want us to waste any further time. I would like to invite the next speaker. Now that we know what the causes of cancers are, or the risk factors of cancer, we know the symptoms. If someone comes down with cancer, what is being done for the patient? And those that are at risk of any cancer, what can be done for those particular type of persons? As we all know, this is just an enlightenment program. We cannot be able to download everything, but just give you the tips so that from here, more inquisition can be made and then more knowledge can be sought about it. So it's my pleasure to invite Dr. Basira Lawal, Consultant Radiation and Clinical Oncologist, National Hospital Abuja, to make her presentation on the prevention and treatment of cancer. Now we have 10 minutes. Prevention, slide. Okay, let me send it to you.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Good afternoon, my sisters and brothers in Islam. I'm not very happy to see that we don't have a huge male crowd. And this is actually very common when we have this kind of conferences. And I think maybe the organizers need to be very active next time to make sure that our brothers come, because this information is, as much as it's good for the men also need to know, because they have mothers, they have sisters, they have daughters. And they themselves may also have cancer. So it's really important that the male members of our society attend this kind of conferences so that we can pass on this information and they can utilize it for their own families. Dr. Omar was saying this is a rapid thing. We have 10 minutes. Unfortunately, I think I didn't get the memo. I think I have about 55 slides. Fortunately, most of my slides are pictures. So I will urge you to have a look at what I'm presenting, because we'll have to rattle through it. And I hope my IT system will be with me as we do this. So once again, I'm Dr. Basira Hanafilawal. I'm a consultant clinical and radiation oncologist, and I practice at the National Hospital Abuja here. Next slide, please. So as part of my synopsis, this is what I'm going to go through, rattle through the introduction, the epidemiology that has already been taken. Then what treatment options do you have as a cancer patient? Okay, next slide, please. We've heard from Dr. Omar that it's the most common cause of death worldwide, so I think this is a very important issue that we have to consider. And like you said, most of the cancers are breast cancer in women, even though we're aware that male members of the society can also have cancer. Lung cancer, even though it's not so common in Nigeria here, colorectal cancer and prostate. So let's look at the next slide, please. I have a map. Okay, so this is just a graph showing the commonest cancers. And as you can still see, in females, breast cancer is still the most common. In Nigeria, cervical cancer comes after breast cancer. Next slide, please. 34% of breast cancer accounts for about 34% of all cancer deaths in Nigeria. And you agree with me that this is a significant number of women dying unnecessarily from breast cancer. 21% of women die from cervical cancer and 32% of men die from prostate cancer. Next slide, please. So let's talk about cancer treatment. We have over 80 oncologists in Nigeria, and we have at least one in almost all the states of Nigeria. So it's important that we create this awareness so that people seek for them when they develop this condition. National Hospital we have about 8 oncologists. We have up to 10 in Luth, NSIA. We have as much number in UCH, we have in UNTH, University of ABU as well as Sokoto. And then we have so many upcoming centers, about 6 of them. So we really have them upcoming. Next slide, please. This is a map showing about the spread of cancer treatment centers in Nigeria. As you can see, they are quite well spread. Next slide, please. So let me start by saying that cancer is really not a death sentence. And I think you've heard from all my colleagues that really cancer is not a death sentence. But it's a life sentence. It pushes one to live, because when you have a diagnosis of cancer, you go back to your rock, you sit down and talk to your Lord, you make things right for yourself. And early detection obviously saves lives. Next slide, please. So we have different treatment options, but for a patient to be treated with cancer, you need to understand that it's a team effort. It's not just one doctor treat a patient with cancer. You need a group of specialists to achieve the best cure for patients. Next slide, please. So that's what we came up with the ET, disciplinary team, where you have a group of specialists. You have the surgeons, you have the medical oncologists, the radiation oncologists, the psychologists, pathologists, the surgeons. We all come together to better take care of the patient and give the patient the best chance of cure. Next slide, please. So our goal is patient-centered care. The patient is our main goal. We want to get patient to the end of that road. Next slide, please. So there are many different options. As I'm sure you've heard, you've probably had a relative, a cousin, a brother, or someone with cancer. You must have heard of so many of these treatment options. Monotherapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, and immunotherapy. So we don't just say, okay, a patient comes to us, what do we do? There are lots of things that we consider. First of all, we consider what kind of breast cancer, what kind of cancer you have. Do you have a breast cancer? Is it prostate cancer? What stage of cancer are you presenting to us? Because that determines what treatment options we can offer to you. How is the patient's general health status? You can't have a patient coming to us and you're not giving the patient chemotherapy, example. What's the goal of treatment? Is the intent of treatment to cure this patient, or do you want to make this patient as comfortable as possible? What's the patient's preference? You have a patient that comes with breast cancer, and you tell her, madam, you need to have surgery and you need to remove your breast. If it doesn't lead to that procedure, there's really nothing you can do about that. Comorbidities. A lot of our elders, our parents, have come to us with hypertension. And so these are things that we really need when we are learning treatment for them. Are those treatment options that we're talking about even available in the first instance? For example, if someone comes to you with cervical cancer, you need to be sure you refer her to a center where she can access radiotherapy. Next slide, please. Like I said, there are several options. Next slide. So first and foremost, usually the patient comes to the general outpatient department of the hospital. For example, I saw a lump in my breast. Most breast cancers, most early breast cancers are not painful. And I think that's why a lot of women have issues. You know, they say, okay, I saw a lump, is increasing in size, but it's not painful. So I really shouldn't be bothered about. Those are the ones you should be worried about. Those ones that are growing and are not painful. So the first port of call is the surgeon. The surgeon goes in and takes a biopsy. So there are several reasons why a surgeon will be present in the treatment of a cancer patient. First of all, to establish the diagnosis, to remove the primary disease. Next slide, please. And so there are different options when a doctor wants to achieve a diagnosis. You can do a biopsy, fine needle aspiration initially to find out, first of all, is this just a benign disease that doesn't have a chance of becoming cancerous, or is this a malignancy? You can also do a core needle biopsy that characterizes better the type of malignancy. And then finally, open biopsy where you can excise the tumor itself. Next slide, please. Then the treatment. There are different kinds of treatment, and I'm taking the case of a breast cancer, you know. So you can either opt for a breast conservation, which involves the removal of only the lump, and then the remaining breast still remains intact. Or if the woman can say, okay, you know, just remove this breast, I'm tired, I don't want to have issues, you know, in the coming years. Next slide, please. So like I said, we need to rattle through this. So there are different options for surgical removal. There's lumpectomy, there's quadrantectomy. We may not be aware, but the breast is divided into several quadrants. So the quadrant that has the breast cancer can now be removed, and the other areas of the breast can remain intact. And there are also total mastectomy, which involves removal of the whole breast and part of the muscles. For a patient with cervical cancer, there are different options as well, and there are different types of hysterectomies. I will not bore you with all that information. So for a patient with a prostate cancer, and I'm looking to my brothers here, you can also have a prostatectomy done. As you can see, there's a before picture and there's an after picture. In the before picture, you can just see some white specks around the lower aspect of the bladder, and that is the, thank you. Yes, so that is the cancer. And then the next slide, you can see the after, where the prostate cancer has been removed. Next slide, please. So the surgeon can also come in. Which one is it? Okay, thank you. Okay, surgeon can also come in, even though the disease has metastasized, he can also do what is called metastatectomy, where he removes the metastasized to other parts of the body. Next slide, please. Then the next thing we will talk about is chemotherapy. I'm sure a lot of people have heard about chemotherapy. Chemotherapy kills. Chemotherapy worsens your condition, but that is not true. I have quite a number of patients that I wish I would have come with them. There's a lady that actually came to the clinic. The first time we saw her, she came with her handbag, her ribbon was in her bag, someone was holding her bag. After the second cycle of chemo, you know, when I saw her, I didn't even recognize her, because now she had her ribbon on, she had makeup, after having 2 cycles of chemotherapy, because it had improved her quality of life. Next slide, please. So I'll also not bore you with how chemotherapy works, but basically just know that if you have a cancer cell, the chemotherapy inhibiting multiplication of those cells, and then those cells die. Next slide, please. So there are different indications for chemotherapy. If you have a tumor that is very large that the surgeons cannot operate on, therapy will help to downstage that tumor such that when the tumor has reduced to an appreciable size, the surgeons can go remove it and then have a good closure. Next slide, please. So like I said, there are different indications for chemotherapy, chemo to reduce the size of the tumor, palliative to improve the quality of life of the patient, and also chemo radiation, that's in combination with the radiotherapy to increase survival. Next slide, please. Okay, so this is an example of a patient having chemotherapy in a chemotherapy suit. I'm sure if there's anything you've heard about cancer, it's the side effects of chemotherapy. And that's why for every patient you have to give chemotherapy, there are some pre-medications that we give before a patient receives that chemotherapy. And this is in anticipation of those expected side effects. So a patient who has had chemotherapy may experience some nausea, she might eventually vomit, there might be diarrhea, there might be fatigue, there might be hair loss. But be rest assured that most of these symptoms are taken care of in the pre-medication. Next slide, please. This is an example of a radiotherapy center, and behind them is a linear accelerator. Next slide, please. So radiotherapy for cancer is actually in two forms. We may not be aware, but radiation is just the use of X-rays to treat patients with cancers. And it can be ionizing, it can be non-ionizing. We use the ionizing ones in the form of X-rays or photons or even particulate radiation. So it can be external beam where the patient is, as you can see here, no, the previous slide, the patient lies on the couch and the source of radiation. So the source of radiation is at a distance from the patient. And then the next slide, you can see a brachytherapy suit where the radiation source is in direct opposition to the patient. And then the one in the middle is the patient on brachytherapy. And then the last slide is a radiological image of a patient with cervical cancer. So this is the process a patient takes for having radiotherapy. Next slide, please. So as you are aware, even paracetamol has side effects. So we have some side effects of radiotherapy that may present early as the patient is having the treatment, or late after some weeks or months or even years after radiotherapy. So some of it in the early stages the patient might notice some skin changes, some redness, some fatigue. The patient might feel tired, and there might even be diarrhea, especially if you are treating the pelvic area. Next slide, please. We also have targeted therapy, and I think this is what has revolutionized medicine, and we're talking about personalized cancer. So the cancer cells express certain receptors on the surface of the cell, and the modern medicine has been able to create drugs that can target those receptors and inhibit downstream signaling, meaning it will inhibit the multiplication of cells and increase the death of those cells. Next slide, please. Immunotherapy utilizes our own immune system. It helps our own system to kill those foreign bodies or cancer cells. Next slide, please. So cancer prevention, I think a lot of this has been taken by my other colleagues, especially my sister Maria, who talks about the risk factors. Next slide. So we have different levels of cancer prevention. We have primary, we have the tertiary. So in the primary level of prevention, what we want to do is to remove those risk factors. But you have to be aware of what you are removing. She talks about modifiable and not modifiable risk factors. You can't change yourself to become a man. You can, I think. But it doesn't mean that but the fact still remains that if, for example, you are genetically predisposed to having breast cancer, when you become a man doesn't mean that you will not develop breast cancer. So that's the thing. So you can modify those risk factors she talks about. Tobacco smoking is actually very notorious for this. And I think most of the cancers have a relationship with tobacco smoking. Unhealthy diet, we need to increase fruits and vegetables in our diet, reduce fatty diet in our meals. Physical activity, we need to increase our activity. As women, as we grow older, we tend to gain weight, but it doesn't help us to keep that weight and keep looking at it. So we need to make an effort to reduce our weight. There are some, like in India, where they chew betel nut. I'm not sure we do that, but I know in the northern part of Nigeria, especially Katsina, where I come from, a lot of the women, especially the older women, tend to chew nuts. And so a lot of them come down with oral cancers. But I'm not sure that is happening anymore. Then we have vaccines available. Hepatitis vaccines are available. Human papillomavirus that is notorious for causing cervical cancer. And so that's why it's often thought that maybe cervical cancer can be thought of as a sexually transmitted disease. If we're able to give a lot of our children, next slide, so that will show that vaccines we're able to take care of that, including the oral cavity tumors. For breast cancer, for example, let's just go back one slide. Like I've talked about breast cancer prevention. You need to keep a healthy weight as a woman, especially as you are growing older. Increase physical activity. You need to make sure you get enough sleep at night. And well, as Muslims, we're not talking about alcohol, so I'll just disregard that. No smoking. And for women now that are coming up, we have a lot of young women that come up and say, I don't want children. Well, that is not a very good thing for you, because studies have shown that breastfeeding actually reduces the incidence of breast cancer. Next slide, please. Cervical cancer, like my sister also talked about, cervical cancer is actually very common in northern part of Nigeria. And that's because a lot of the children get married at a very early age. So those are things that we need to talk about. They have multiple marriages. The men marry more than one wife, and they marry one dog and move to the other, because we've lost the essence of Islam in family. Smoking also is actually quite important. Exercise also in cervical cancer. HPV vaccine, you can give your children age 9, both girls and boys, and that prevents the spread of human papillomavirus, which causes cervical cancer and a lot of oropharyngeal cancers. Next slide, please. So for men, I haven't left the men out. You also need to eat healthy. You also need to exercise. We also need to see that you are fit. Quit smoking and also get regular checkups. Next. So, like I keep on saying, early detection saves lives. That is the only way we can prevent the spread of cancer. Early detection by the form of screening and early intervention, going to the right doctor at the right time. Next slide. So how can you prevent yourself from developing breast cancer or getting the aggressive form of breast cancer? Breast examination. Monthly breast examination. I think we have slides that go around. You can get more information on that. Pap smear. This is done in most general hospitals, and it's not painful. It's not painful at all. Breast ultrasound. There are a lot of these radiological centers that do, especially during Cancer Awareness Week or Cancer Awareness Month, they do a lot of these services free. So I will urge you to please take part in this. Breast mammogram for women that are 40 and above. So pap smear, like I said, is not painful. For men, PSA. Once in a while, to go and check your PSA. Stop smoking, especially to reduce the incidence of lung cancer. Next slide. So tertiary prevention, and that's really where we come in. We need to stop the disease from from progressing actually. And what do? You come to the hospital at the right time, you follow your doctor's instructions and inform your relatives. Next slide. So in summary, what I want to say, and I hope I didn't bore you or make you go to sleep, early detection saves lives. Stop smoking. Please exercise. Check your breast regularly. Have your pap smear regularly as instructed by your gynecologist. Next slide, please. Thank you, and have a nice day.
Thank you very much, Dr. Basira Lawal, for diligently taking us through treatment, prevention and treatment of cancer. But in essence, she just tried to make us know if someone comes down with cancer, what is being done, so that we will know when somebody is going to the hospital, these are the things that are being done, and you can be able to help to educate patients better. And for the general population that are healthy and we wish to stay healthy and free of cancer, what can we do to increase our chances of not coming down with cancer? Thank you very much, Dr. Basira Lawal. Just on the funny side, a disclaimer to what she said. She mentioned about polygamy and multiple marriages. So don't come and say we specialists, we said this about polygamy or that. What we are specifically just saying is multiple sexual partners is a risk factor for cervical cancer. Meaning a woman who moves from one marriage to another concurrently, having multiple sexual partners over a long period of time, is predisposed. Or a man or a woman whose husband is doing kwashe, that's, I don't want to mention any profession, but you are moving here having a lot of sexual partners unaccounted for outside marriage and all that. But usually studies have shown that people who exist in stable polygamous relationship, they have the same risk as those who exist in stable monogamous relationships, so that you don't quote us anywhere or out of it and say the oncologist said here. Before we move to the next session, I want to specifically recognize the presence of our father, one of the imams of FCT Abuja, who is also the secretary of the FCT Imams Committee. He is coming to represent the Committee of Imams and FCT. It is upon your guidance and the knowledge you've taught us that we are bringing it back to come and deliver. We want to recognize the presence of Imam Mujahid Amin bin Abdurrahman. Sir, you're highly welcome. And we would like to, thank you. And we would like to take some 2 to 3 minutes pause.
أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على خير الأنام نبينا محمد وعلى آله وأصحابه ومن دعا بدعوته واستنى بسنته إلى الدين وبعد. My fellow Muslims, brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Really, I am highly delighted psychologically to be given this opportunity to be with you this particular day, and also these important programs, two important events. To me, really, World Hijab Day, and also anything has to do with our health, especially elaborating something about cancer, definitely is very, very, very important. It's unique, really, especially when I listening to our mother and also sister, that is Dr. Basira, really elaborating this illness. Really, I'm quite impressed, and alhamdulillah, I understand a lot of things. May Allah reward her in abundance. Definitely we pray for the organizers of this program. May Allah tabarak wa ta'ala reward them in abundance. If you look at the Surah Al-Ahzab and Surah Al-Nur, you see ayat that elaborate about hijab. Hijab is not only to cover the body of woman, really, as a lot of lecturers mentioned here. Alhamdulillah, hijab is a sign of the obedient woman to Allah tabarak wa ta'ala, and also is the identity of a Muslim woman. May Allah tabarak wa ta'ala reward the organizers in abundance. Really, I am here to represent Dr. Tajuddin Bello Adigun, who is the chairman of the FCT Imams Committee Initiative. May Allah tabarak wa ta'ala reward you in abundance. Really, this quick fact about the colorectal cancer, that is CRC, really very, very important. And doctor mentioned that really the men are very few, maybe because of the nature of the enlightenment to the people, that maybe men did not understand the importance of the program. But really, as FCT Imams Committee, inshallah, I will take this message to Dr. Tajuddin, inshallah. Always, if this program organized, inshallah, we will enlighten our people, inshallah, to come a very big crowd, inshallah, for the program, inshallah, because it's very, very important. So may Allah tabarak wa ta'ala reward you in abundance. May Allah tabarak wa ta'ala accept our all supplications. Jazakumullahu khairan. Assalamu alaikum wa rahmatullah.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you very much, sir, for the good message. We appreciate it. So without wasting much time, we'd like to go to the next segment. If there's one of the most controversial or well misunderstood diseases in the world, I think cancer is one of it. Cancer is one of the diseases that has a lot of, everybody is a scholar in one way or the other about cancer. Everybody has his own understanding of what cancer is and what cancer is not to him. And we are trying to, despite the lecture we've given, we want to talk about the myth and misconception about cancer. What is not cancer and what is cancer, so that we can be able to be further enlightened. Some of the myths, they are very laughable. Some of the misconceptions, they are very, very funny. But as funny as it is, it affects people's lives and the decisions they take. So we'd like to invite Dr. Salisu Ismail, consultant cardiothoracic surgeon and the past president of the Islamic Medical Association of Nigeria, to come and talk to us about the myth and misconception about cancer in the next 10 minutes. Sir, welcome.
سيدنا محمد وعلى آله وصحبه وسلم وبعد السلام عليكم ورحمة الله وبركاته. Please, can we go to the next slide? You know, even as health or medical practitioners or health provider, many a times such misconceptions can arise, and what usually we stick to, whichever information comes, we always remember what is there documented in the books, what has been treated during your training. Is there anything within that cycles? So if not, then people doesn't bother much about it, because whatever need to be known has been described. So if we can use this basic principle from what we have gotten in these presentations, the introduction, the distribution, the symptoms and signs, the treatment, anything that is outside this cycle is not so important actually if somebody will come and say this causes cancer. So if you can try as much as possible to use this principle. Many a times what people brought is speculation, assumptions and correlations with so many things that will now associate it with likelihood of becoming either a risk factor or something that can cause cancer directly. And one thing I wanted also to mention is many a times patients that we have, especially in this part of the world, they presented late at a time when even the surgery cannot be peacefully done. So you have to revert to what we said, palliative. Palliative is just a supportive treatment that you are not expecting that patient to come out of that conditions. So we hope people can use this knowledge to try and guide themselves and guide their relatives towards understanding about cancer. Next slide, please. So one of the myths, which is quite common, antiperspirant or deodorants, which you see it so many, in so many places that it causes cancer, especially breast cancer. So the same thing, what science is based here, if there is no any scientific evidence of something being confirmed by world scientists or by people that are in the specialty or that are in the discipline, so nobody will regard it as a direct link except if there is any supportive evidence. So far there is no supportive evidence regarding the use of antiperspirant or deodorant that are associated with causing either breast or any other cancer. Next, please. The other issue is the issue of microwaving food in a plastic container. Also, people were talking about that, and the basis of that, people were thinking that when you heat that container, it may emit some chemicals, and the chemicals can mix with the food, and at the end you will keep taking the food with chemicals. So what is guided here, provided that container is microwavable, is safe to be used as in microwaves. Once it is written there by the production company and is reliable, then you don't have problem with that. Definitely there are so many containers that heat can lead to emanation of some chemicals that can be detrimental to people's life. So the guidance here is to make sure that that container is safe to be used in a microwave. Next, please. Issue of using sugar, and this also is quite prevalent, that if you take sugar, then it may aggravate the growth of that cancer cells. So not only cancer cells, all the cells in the body depends on sugar to get energy, and every cells, definitely. So the larger the number of the cells, the greater need for that sugar to get energy to survive. So sugar doesn't have any specific risk to anybody with cancer, because if you reduce the sugar, it doesn't stop the cancer from progression. So this is just the scientific ground of that. Whether you also give more sugar, it will not aggravate the progress. So each cell needs sugar to survive, and that is the basis of living for any human or even the animals. They have to get that to survive. So that is one thing regarding that. So actually it has no scientific backing. Next, please. So whether the cancer is contagious. Contagious in medical terms that if you stay with somebody close, if you stay close to somebody with cancer, you can easily contact that cancer. So cancer is not contagious. Most of the diseases that are contagious are infectious diseases, which you can cough it out, you can get from skin contact, also some other close contact. But cancer is not regarded as one of the contagious diseases. So staying with somebody with cancer, no matter how close you are, it doesn't mean that you are going to take that cancer to the other person. Next, please. So people also talking about when a woman has spontaneous abortion, especially towards the later of pregnancy, then the breast milk that is produced cannot be used since the baby is late, or the woman has abortion, so the breast will get spoiled, and that breast will lead to, breast cancer. So this also has no any scientific basis. Even though the breast is there, breast has never getting spoiled except if there is infection. Otherwise, breast is always fresh in the breast before it is being extracted out. So once there is no pregnancy or the pregnancy is terminated, then gradually the lobules will get, shrinking down and everything will stop. So there is nothing like that breast will now cause trouble to the woman. Next, please. So when the man is not sexually active in his younger years, and later when he go above 40, the prostate will get shrinking and this will lead to cancer. So this also has no scientific basis actually. So there are so many other issues that people will keep correlating. So that is why people will keep bringing this information. And the moment you keep reading this, the moment you become confused about the whole things. Next, please. Then issue of wearing a black braziers by women, that it can lead to development of breast cancer because they believe that dark clothes, then they can easily transmit or emit some things. So this also has no scientific basis. Even though we know there is difference between white and dark clothes when you go under the sunlight, but there is no any literature or documentation that says that differs the color of the clothes one is used as braziers or not. Even sometimes they were talking of tight bra, and that one also they associate with the sweating and so many things. All those ones, they don't have specific scientific basis, especially this color of the brazier one is using. Next, please. So, and they said if one smokes and then follow it up with alcohol, it flushes the harmful effect of the tobacco. You can see the double harm. One smokes and also takes alcohol to flush it out. So also this also causes, like I said, double risk, because alcohol actually is a risk factor for so many diseases, so many malignancies. The same thing with smoking. Next, please. So talk of dark skin, whether they don't develop cancer. We know that light skin, they have less melanin and they are more susceptible to ultraviolet radiations, which ultimately can lead to cancer. But dark skin doesn't mean that they don't develop. In fact, in the previous presentation, we see a skin cancer on a black or dark skin individual. Next, please. Laptop, when you are using your laptop prolonged on your laps, whether it will cause skin cancer. We know there is emission of heat, but this heat actually is electronic and magnetic, radiations, but it has no scientific basis that it can cause cancer immediately or directly causing cancer. So this also is not being supported. Next, please. The issue of multiple sexual partners actually has been raised. Actually, once there is multiple sexual partners, so there is risk for sexually transmitted infections, and transmission of human papilloma virus is quite high. So if care is not taken, then there are so many dangers that might happen. Next, please. So these are basic, okay. Cancer is not disease of hospital, yes, of course. This is one of the local misconceptions, that our local people were told that once it is cancer, there is no issue of going to the hospital because it doesn't like injection. And they said the moment you are giving injection, then it will fly it off. And many a times, this patient will come to the hospital late, and when you started the injection again, they will really suffer, and at the end they will die. It's not that is killing them. So, but that is supporting actually what the local people were thinking about. Cancer is not a disease that you go to the hospital. This is causing a lot of presentation to many patients, and at the end, nothing can be done to them. Next, please. Attitude, whether positive or negative, determine the risk factors of getting or surviving from cancer. You know, this also we talk about it, modifiable and non-modifiable risk factors. If you will modify your life, then you can easily get out of it. And this is the only thing we can say here. But other attitude, whether you get angry or you do this because you have cancer, that doesn't really change anything. But this will just talk it up as per your attitude, because smoking, alcoholism, they are all part of, you know, bad attitudes. Can cancer surgery or tumor biopsy cause cancer to spread in the body? People were also thinking that when you touch it, but you know, surgically, there are so many techniques when you want to take biopsy or when you want to treat any cancer. So there is no any problem with those techniques. The overall issues is even to support and the patient get health out of it. If you are planning to excise a tumor, so definitely you take biopsy within the cycle where you are expecting to take out. So this is one of the simple things we are going to say, but biopsy, do not take it out as like people will run away from it, because you have to get diagnosis before you move forward for treatment. Will cancer get worse when it gets exposed to air? This also has no scientific support. Do cell phones cause cancer? There is no scientific backing for that. The power lines also cause cancer. This high tension, they are all electromagnetic radiations which has no direct link that it can easily cause cancer like that. So, but there are so many changes that it may cause in the body, and that changes will subsequently lead to, you know, some disturbances in the cell growth and development. Like at the beginning of this lecture, I said cancer is a group of diseases. Before you ultimately get cancer, so many things had happened along the way, which if you arrest it, the ultimate result may not appear. Are there herbal products that can cure? I think one of us has told us that really the traditional medications or any herbal, there is no any one that is known to be, you know, the cure, even though we cannot say that there is none, but we don't have enough evidence or enough investigation on those ones to confirm this can be directly used. Because most of some of the medication used, they are extract of those things. But because we didn't do the right, you know, investigation, so we cannot clearly say that it can kill, cure cancer. But our local people were saying that, and this is what they cause a lot of problem with presentation. Next, please. This one is issue of contagious. Cosmetic use, also no scientific support. Cancer is artificial, is man-made. These are some of the belief, you know, that, you know, stop so many people from getting early, you know, diagnosis and treatment. Next, please. So what do we need to say here actually? Like I started, first we need to really understand diseases are there. You know, cancer is there. Cancer has been known over years. So there is nothing to deny the existence of cancer. Then subsequent, apart from this, we need to know that there are so many ways to detect a particular disease which has been highlighted in this forum. So we need to really stick to it, and we need to support our Muslim brothers and sisters to understand that, so that we can present early and also get supported early. Anybody who is involved in the clinical practice will tell you that there are so many patients that we keep remembering, you know, they came to us, but they are all late because they came late. There is nothing one can do. All what you are going to do is to keep the patient just to get some support, some comfort, not to cure. And there are so many of them that get it early and they were treated and they are still with us. Some of them are coming for follow-up, some of them have even forgot about the follow-up. So in this part of the world, like I said, our major problem is to understand and believe so that we can easily come when it is detected. And of course, we should try and stick to the teaching of Islam, because once we stick to the teaching of Islam, it will take us a long way in preventing us from contracting so many diseases, not only cancer. Next, please. So, cancer is a very common illness that has been in existence several years ago, but despite long history of its existence, still many people have misunderstood, many people have misunderstood the disease. And the importance of the wide awareness campaigns against cancer, its onset, treatment modalities and prevention cannot be overemphasized. This type of program actually is quite important for us to get proper understanding about the condition and also to see what we can do for ourselves and for our loved ones. Thank you very much.
The typical picture of a cancer patient we all know is once somebody is diagnosed with cancer, somebody just gets depressed, cannot help, he cannot walk, he just continues to move from one condition to the other until the patient dies. This is the typical picture we have about cancer. We hardly have that picture that somebody can actually come with cancer diagnosis, get treatment, walk on his feet and continue to perform his or her activities. That's something that if you tell people, you say, hey, where did you see that type of thing? So that's one of the reasons why we have the next presentation. And so that you don't even say that we even went and co-opted somebody that maybe we don't even know. So this is our father here with us in the person of Harun Usman Ugu, who is going to tell us about his cancer journey. Alhamdulillah, he was diagnosed with cancer some time ago. He did the right things, and Alhamdulillah, I can see that he even came and addressed us earlier, and then he's going to come and address us more specifically on this issue of cancer. If maybe all what we have been saying is maybe not true, so he will confirm to you whether what we have been saying is true. If what Dr. Basirala presented as this treatment is to work or doesn't to work, he's going to come and shed more light about it. So it's my pleasure to invite our father to come in his capacity as a cancer survivor to give us his perspective on cancer. Thank you very much.
أعوذ بالله السميع العليم من الشيطان الرجيم. اللهم صل وبارك ورحم على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد مجيد. أما بعد السلام عليكم ورحمة الله تعالى وبركاته. On behalf of MESH and their partners who organize this program, I want to make this announcement to appeal to our brothers and sisters who are outside the hall to please come back till the end of this event. It's not good you organize a program, you invited experts to talk to you, and while they are talking to you, you take your leave. This is not Islamic in any way. It was condemned right in the time of the Prophet. He was delivering khutbah, and some Muslims left to go and chase merchandise. Am I right or wrong? Then why are we repeating it over 1,400 and something years after the Prophet? We should stick to Islamic precepts, please. Like it has been said, I would like first to start by endorsing what the experts said. Because the English people say that the taste of the pudding is in the eating. Then the Oyibo man also says that experience is the best teacher. Although this particular pudding is not the one I wish anybody in this hall, their relations, their friends, or even their enemies, if you have any. Then it is an experience that is better imagined than actually experienced. By way of introduction, I'm not a medical doctor. Therefore, it follows that I'm not even an oncologist or an expert on cancer and all the issues relating therewith. My only qualification to speak today is because I am indeed a cancer patient and undergoing chemotherapy. And because I believe no situations are alike, the topic I was given was cancer journey from diagnosis to treatment. But I believe A's experience may not be exactly the same in all material particular to B's experience. I took the liberty to add my in the beginning of the sentence, and it now becomes my cancer journey from diagnosis to treatment. My name is Architect Zubairu Haruna Usman Ugu, Director of Administration, Nigeria Supreme Council for Islamic Affairs, and I'm standing before you to say my journey, my cancer journey from diagnosis to treatment. Diagnosis. I had surgery on 31st March 2022 for intestinal obstructions. This followed 2 weeks of excruciating pain anyone here can imagine. I went through serious stomach pain before I was diagnosed of intestinal obstruction, and the need arose for me to go through surgery. I jokingly told my mom that I've never been to the labor ward, and I used to hear that the greatest pain is labor pain. But I told my mom, it's like this pain, it's more than labor pain. He said, how do you know about it? I said, because even after labor, people go in again for second child, return for third child, return again for fourth, fifth, as the case may be. But this one, I do not pray to go through it another time. This is the basis of my argument. Counseling. When some samples of tissues were taken from the lump taken out of my body during the surgery was taken for biopsy, it came back and they started suspecting it's malignant. More tests were referred to the lab. I won't mention them because I've already told you I'm not a technical person. I will just be saying what happened to me the way it happened. The doctors had handled all the technical aspects. The result came back and they confirmed I have colon cancer. They talked to me encouragingly that this diagnosis does not mean instant death sentence passed on me. I looked around me in the consulting room. All the members of my family were wearing long faces. From that, I knew I was the last person to know my situation. Maybe members of my family would have been taken into confidence about my situation. But something happened. I was even the one that doused the tension in the room. I told all the medical team, with due respect, I'm a Muslim. And they said, how does that help me out of the situation? I told them that in Quran 26 verse 80, Allah said, and when I fall sick, Allah is the one that restores my health. Then I told them that the Prophet was quoted as saying that before Allah creates any disease, He has created the cure. I concluded by saying, Sadaqallahu Azim wa Sadaqal Rasulul Mustafa. I told them, do you know what I mean? They said no. I said, Allah spoke the truth, and His messenger, the chosen one, also spoke the truth. I'm ready for whatever you want to do with me, and I will survive. This is what I told them. Then they listed all the options available to me, and they chose chemotherapy as the option that is, under the circumstances, most viable and most feasible. I repeated to them again that I will come to give testimony one day that I was sick and Allah healed me, in line with Surah Ashura, verse 8, and that is what is happening today. I never knew one day actually I would be invited to speak. And this person standing before you is a miracle of God on 2 feet. Because from the day I entered the hospital, I was weighing 77 kilograms. Before the chemotherapy, it has plummeted that drastically to 60 kilograms. Within those small space, I've lost 17 kilograms. So some of my friends and colleagues in the office were prevented from seeing me, not because of myself. I felt concerned for them, because at that point, I was already a walking skeleton, or call me a ghost, you are not far from it. I was worried after seeing me, they will be disconcerted. They will be denied sleep for some time each time they remember me. That was why you are now knowing why when you came to my house, you were lied to that I'm sleeping or I've gone to hospital. This is just the reason. I was also considering you the way you were considering me. Treatment, initial hiccups. I had declared my readiness to start treatment, but suddenly there was infection. Infection of the highest order. Everything about cancer comes in the highest order. They started with anti-infections, biotics, nothing happened. When we go back for tests, we found out that it has multiplied. They went on to another alternative, the same, until they applied the highest one. I was asking them, why did we wait these 8 weeks before we got it under control? They said that they couldn't have gone to the highest antibiotics ever on the surface of the earth, that it is their procedure to be going the way they did. But at length, from diagnosis to first chemo session, it took 9 weeks. Then chemotherapy session started first week of June. Oh my. There are a lot of effects of chemotherapy treatment. I will just list them. One is fatigue. You are so tired, you feel you have zero energy. And actually it was true. This my phone. I could not hold it because the weight was too much for my body. I couldn't hold this phone. It weighs less than a kilogram. And somebody who was weighing 77 kilograms could not lift it from the table. Secondly, when I'm talking, you will bring your ear to my mouth and you wouldn't hear my talk. The level of energy in me could not activate my vocal cavity so that you hear the sound coming from my mouth. It was now resolved I should not make call or answer calls. For the next 4 months, that was what happened. And then that's when people thought I traveled out of the country. But it is far from the truth. Nausea, I was always having this feeling that I'm sick. I could also vomit from time to time. But the good thing is that whatever comes, the medical team will keep it in check. They are really, really very hardworking. Then this nausea, when they gave me medicine for nausea, it raised its own problem again, like indigestion, constipation, severe headache, and I had problems with sleeping. Then there were changes in my skin and color. I would have patchy and dry, coarse skins. My hands turned black. The soles of my feet turned also black. My nails were discolored. I had itchy and sore skins here and there. Infections, once in a while before each treatment, which comes at 3 weeks interval, we would go for tests. Now and then infections will be seen. I continue asking them, why am I on medicine and I'm always having infection? They were now telling me that chemotherapy is such that it is killing the cells as well as depleting my red blood cells, and that lowers my immunity. And then the white blood cells that are meant to fight infections will now be greater. All these were technical jargon they were telling me, and I continued being faithful to them, believing them, and Allah was leading us from one stage to the other. Sore mouth. At times I will feel pains in my mouth. When I'm brushing, it is as though my teeth are going to pull off, and then we overcame that. My mouth will be dry when I wake up in the night, as if I don't have single drop of saliva in my mouth. I will take water. Loss of taste. This one was more problematic than any other, because they continue telling me for the medicine to work, I should eat very well, drink a lot of water, take a lot of fruits. But do you know what happened? I lost taste. If I'm eating rice, it's no different from if it is gari that is in my mouth, no different from semovita. No, any food that enters my mouth, there is no differentiation. If I'm taking fruit, mango is not different from guava, guava is not different from this. My sense of taste is now my eyes, which is meant for sight, not for taste. That with my eyes, I know this is the food I'm eating. But every other thing turns like ashes in my mouth. God took care of that at a stage. Loss of appetite. With all this kind of thing, food is not your best friend. Yet that is what you are encouraged to eat so that the medicine will work for you. When my wife brings food into the room, my countenance will just change. They will be begging me that we will not give you much. How many spoons? I say, give me 3. 3 spoons of rice, imagine. He will say, no, 3 is too much. I will give you 2. When I finish it, he say, you even said the 3 before. So let me complete the 3. In the process, he will add 2 more, and so on and so forth. This drama was going on, and then God answered prayers. Then there is jaw knock. You open your mouth to eat, to talk. You cannot talk. You cannot close it. And you are undergoing the kind of undescribable pain in your jaw bones. You want to put food in your mouth, you open it, you can no longer close it to chew the food. All these things were happening. Sleeping problems. You find it hard to sleep, and when you sleep, you wake up, you cannot sleep again. At times you have diarrhea, at times you do not have it. Emotional issues. This one was real. You are so frustrated, you are so stressed, that you are ready to bounce on anybody for any small slight, unless you are enveloped by the grace of Allah. At the end of it, I made mental jotting some takeaways from all these experiences. That indeed cancer is a deadly disease, but that does not mean that it's a death sentence. It requires long treatment, unlike malaria, headache, and other ailments which get treated within a short space of time. Like I said again, it's not death sentence, but survival is a function of early detection, right treatment by experts. We didn't go to Babalao, we didn't go to any Dibia according to Igbos. We just went to the right place, and that is why perhaps I'm still here talking to you. It's an ailment which treatment is very costly and expensive. It needs to be tackled through public-private partnership. There are no two ways about it. Only few people could cope with the financial demands of this. When Oga was talking of 40,000, 20,000, 30, I was just laughing. It is in millions. That is just the truth. Cancer tasks the patients and mettle of all involved. The doctors, the nurses, all caregivers in the hospital, and the family members. They need to show the patients love. The patients also have to be very patient and follow whatever the doctors show them. It is not anybody getting angry and so on and so forth. Like one day when they took my BP, all my life I've never had BP beyond 120, even at my age of 63. That day it went to 140. The nurse shouted, "We are not moving anywhere." I say, "My daughter, come, we are moving somewhere. I'm still alive." Until you clinically say I'm dead, that's when the road has closed. Then another doctor cheated her, and then we kept going. Cancer in Nigeria had dedicated, deeply knowledgeable, skilled medical experts on cancer. I think they are called oncologists, as we have learned, with the right attitude to give in their best, even in the most tasking environment. I found it out here. Even members of my own profession, architects, I will condemn them for collapse building here and there, but experience has shown me that when I want to talk about oncologists, I will think first before I talk, because all the things we feel about medical doctors in general and them in particular are not true. I'm a living example of that. Government could do more in the area of cancer detection and treatment, for there exists wide gap therein. You can see how many oncologists we have in Nigeria. He mentioned it. And a few states, how many they have. Other states, they do not have at all. Federal government should take it as a challenge to even make sure that scholarship are awarded to people who have innate abilities to read medicine, and when they finish reading medicine, to specialize as oncologists. Then the private sector should also collaborate with the government to hold this kind of sensitization campaign, to do free screening, to subsidize cancer medicine treatment in Nigeria, and everything will be going very fine. Conclusion: cancer is undoubtedly a deadly disease. However, if detected early and tackled with the right treatment by right experts, the rate of survival will indeed be high. The treatment for cancer poses some side effects. It is also very expensive. I did not experience some of the side effects listed by the experts. Take, for instance, loss of hair. My own was the opposite, and the experts told me they don't know why. I used to shave twice in a month. I started shaving every week, because instead of losing my hair, they were instead growing as if the chemotherapy was fertilizer for hair growth. There were other issues happening to me. I was telling the doctor said honestly he doesn't know those ones, but they would document it as experience they've encountered. Bashfulness would not allow me to say those ones. It's better if cancer and all related issues were handled in an enduring partnership between the public and private sector. I thank you very much for your attention. May God bless you, and make sure that I pray Almighty Allah that none of you, your friends, your colleagues, and even enemies, like I said, would even dream about this disease, talk less of experiencing it the way I did. And may Allah continue to empower our oncologists to continue with their good work, and those patients that are in hospital receiving treatment, may Allah heal them in his instructable words in the Quran, when I'm sick, only Allah restores my health. Astaghfirullah wa azimul lazi la ilaha illa wa hayyul qayyum wa atubu ilayh. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Thank you, sir.
At-Takbir. At-Takbir. Our father would not have said it better than he did, narrating a personal experience and taking the attention to give us the detail. I'm sure if we didn't understand what the oncologists were saying, we could be able to relate with what he said. Thank you very much, sir, for sharing your personal journey. We appreciate, and God willing, will take your presentation and possibly forward it to the appropriate channel, inshallah. On this note, one of our guest presenters, Dr. Basira Lawal, actually missed out a lot of activities today, and she craved our indulgence to leave. And also, our father also has some other engagements. So we just want to quickly take a group photo, then we'll just do the last presentation and call it in, inshallah. So the official photographers, please. Yes, please. Yes, please. Please, all the suspects, can we stand up to maybe females on the right side, males on the left side? Yes. And we came and talked about Hijab Week, and more importantly about cancer. Now the message is now to us, after learning all these things, what can we do? What can we do? We ourselves, organization, we came together. Dr. Ishaq Lawal just mentioned it in a private discussion with us. He said he is somewhere at the national level. He's assisting our other brothers in other faiths to run these programs. But he doesn't see us as an organization doing anything about it. And he's worried. He's a Muslim, he cannot assist his own fellow Muslims because there are no organizational structures. So what can we do as Muslim organizations coming together to help our communities towards prevention and treatment of cancer? We are having our mother here, Dr. Elwa, who is going to tell us what we can do as an organization. Thank you very much, ma'am. I think you can sit down.
I have sat for long.
Okay, so if it will not distress you.
You didn't see it?
All right.
Assalamu alaikum, brothers and sisters. Assalamu alaikum. Alhamdulillah, at least now we have, I can say, roughly half of the hall back. That is good. Otherwise, we feel as if we are just talking to ourselves. Time has gone really far. So what I'm going to do is to go straight to the points. What I'm going to talk about, that is the role of the community, the Muslim community leaders, as well as the organizations. And I don't know whether we have a lot or more of our religious leaders here, because they have to listen to what we can do as Muslim leaders and organizations in order to see how we can control this issue of cancer. So in my presentation, I just have 7 slides, just 7. So I'm not going to take more than 5 to 7 minutes, because we are just going to talk straight to the points. A lot has been said, so we are overwhelmed with everything about cancer. What is remaining now is what are we expected to do as Muslims, leaders, and Muslim organizations. Okay? So, just like what I have said, this is introduction. So from these slides, there are just 7. I'm not going to talk about all the 4 bullet points there. Is what cancer control brings about people and organizations together to do what? To coordinate actions, policies, and services. These things are in existence, but what are we expected to do for us to achieve that? What we do is that we agree on the most effective solutions, which you will see later, and also taking in account the specific needs of our group. that may have disproportionate rate of cancer and death, and we have heard about them. Okay, next slide. Now, from this one also, I'm not going to talk all about this. Okay, so we agree and we all know that our Muslim leaders, our organizations, we are all willing to work with what? The health workers, and that is what we are doing. Like me standing here, I wear 2 caps. I'm a professional medically and also doing my own work as a volunteer. So we see that there is that coordination between we the Muslim organizations and also as professionals. And also, why I'm asking about the leaders here is because there is need for us, you see, as organizations and leaders to work through various persuasive communications to cause this sensitization, to encourage screening and reduce barriers. Dr. Ismail has talked a lot about this myth and misconception. Dr. Umar has also made mention that prevention is not all but treatment. But these barriers to receiving this treatment are the fundamental problem to cancer control. So what are we expected to do? So the role now, our own role, the role of community leaders, Muslim community leaders, okay, is to what? To build a strong coalition. And you can even see from today, there is coalition of organizations. So that one is already there. That involves representatives from all sectors that form a multi-sectoral stakeholders, including businessmen. We know how to approach. I can see from our cancer working group that many people are involved to support today's action. So it means we are already on. All we have to do is to coordinate and network. So, I'm controlling. Okay, here. So already I have already talked about this one. We have the coalition. We have this, and that. Next slide, or I can continue from here. So now the role of these leaders, as already mentioned, is that prevention. Prevention has been mentioned severally. So what are we expected as community Muslim leaders and organizations? This sensitization is very, very important. And they have made mention about all these use of tobacco, weight, and this. As religious organizations, we are now to support this to be enhanced through the sermons, okay? Through organizations or gatherings to emphasize to our people. Here, tobacco, if you remember my introduction, I said to enforce policies. There are policies that say there shouldn't be smoking in public places. So as an organization, we can lobby that these rules can be enforced. And even maintaining eating good diet is Islamically, when you eat, you are expected to make some steps. Now, finally on this slide, what I want to talk about is the issue of the vaccination that the oncologists have mentioned. We as religious leaders, we are now to encourage our Muslim brothers and sisters to accept this vaccination, because there are so many misconceptions about especially the HPV vaccination, that it may cause promiscuity. So that is our own role to clear that, okay? And also, now, next slide. Now, here awareness is very, very important. We have had that is not the cancer itself, but presenting it early enough. So we are through our own organizations and our own leaders to make sure that this is continuously done in our mosques, through sermons, in schools. We have so many schools, Islamia, even co-educational. Through outreaches, the Awad do a lot of outreaches, even hospital, Muslim organizations they do. So we can all get through gatherings. So this is how we can control. And finally, Dr. Umar has made mention, or is it Dr. Ishaq, about treatment. Now, there is need for support for the patients and also their relatives. We have heard from our brother architect, there is need for that support. Okay? Next slide, next slide. It's not responding from here because I'm almost done. Next. Okay, so I have mentioned about the role of the organization. This is almost done. So emphasis on the community. We have talked about the health issue. So our own is like a reminder as organization, because the community respect the leaders and they respect the Muslim organization. So our own is to keep emphasizing, to keep reminding through sermons, in gatherings and the rest. And also what? To increase access about how the information, okay, and also where they can get these services. To also seek for political commitment. Yes, as organization we can do that so that this prevention and treatment control can be achieved. We have the national plan. Okay, so our own support is to also lobby to make sure that they are enforced. Also to seek for strengthening of health system of the hospital and local governments. Just like we had about what Dr. Umar said earlier, how many, I think it's Basira, about the number of the oncologists. So also there is need to see that more are sent to those areas and ensure that laws are introduced or enforced to prevent cancer hazard like the tobacco and the rest, and also air pollution. In your own area, you see they start burning all these, what do you call it? These leaves anyhow. So if the government can also enforce that, then sustaining these non-smoking signs in offices and public areas, all these can prevent, because we have had that tobacco is another major cause of cancer. Okay? So in conclusion, I promise you that I won't take time, is that prevention is very, very important to control cancer, and it must be given a holistic approach. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you very much, Dr. Belwa, for your beautiful presentation and orderly presentation. We appreciate. This is the beginning of the ending of this session, and we want to thank everybody that came here to share one form of knowledge or the other. Before anything, there's I think there's a service provider that wants to subsidize mammography and also breast ultrasound scan for the first 20 people that show interest. So please, if you are interested, you can maybe meet Barrister Amasa or Hajia Khadija for more information, or Hajia Rahma for more information about it, or even register for it. A lot of private questions have been, okay, yes, they will be around, so it's a continuous process, so you can just inquire for more information. There are a lot of private questions that we have been receiving. We've talked about HPV, where do we get the vaccine? We've talked about cervical cancer, how do we go to the hospital and the rest. That's one of the reasons why we brought all this barrage of oncologists, so that either through your organization or through direct contact, you can be able to inquire more specific information that is specific to you. Inshallah, I think during the, yes. So if you have any inquiry about what you want to do or what you want to do, please you can feel free to meet any of, through your association or something. We'll definitely get the right information for you. If, for example, you ask me about where do you get HPV vaccine now, I tell you in this particular store or something, when you are ready in the next 1 month, it may not be available or something. So I want to believe that any person that came to this place should have the advantage of having direct communication with cancer specialists. So the other issue is the take-home messages. So we've learned a lot from morning till now about hijab, about cancer, and what we want to do. The most important thing about knowledge is to make use of it and also to spread it. So in summary, all what we have been talking about, cancer, even though it's a deadly disease, to some extent, some cancers the cancer can be controlled through prevention Those that cannot be prevented, you can diagnose them early and then institute prompt and adequate treatment. These are the modalities we will use to control cancer. So we at individual levels now, what can we do? What can we do at individual level? The first thing we can do is we can continue to create awareness. Let people have the proper knowledge about cancer and let our community generally understand what cancer is. Once you have the background knowledge before you or your friend or your family have the cancer, it's easier for you to be able to act based on the knowledge. Then very important is that we should also be able to establish community-based screening. If the government cannot be able to provide it for us, our organizations can have a sort of community-based screening. For example, now from one is a gathering, maybe you can make it that the target is at least 70% of all your members should have undergone this screening periodically as at when due, and then it is integrated in the activities or program. Like MSS now, we usually have annual IVC or so. We can invite the technical persons to come and do the screening for the people that are around. And if we continuously do it on a regular basis, then a significant proportion of people will be screened. Then very important, as Muslims, we must live healthy lifestyle. I think once that particular statement has already been dealt with in many lectures, and then we have to avoid the modifiable risk factors so that we can be able to increase our chances of not coming down with cancer. Then very important, cancer patients need support. Our organizations, our community should be able to provide that needed support to be able to help cancer patients financially, psychologically, socially, spiritually, and the rest. So what can we also do? We can also be able to use our organizations to create advocacy at the government level. Government should increase the workforce on cancer. They should ensure that cancer patients are being covered by NHIS, and also the cancer treatment is covered by NHIS. They should be able to fund functional cancer centers, and then they should also be able to fund programs that deal with cancer control, and then they should be able to fund local researches on cancer. Dr. Ismail was saying something that we have not researched about our own Islamic medicines to see how we can be able to see cancer. Or we have not even researched enough about the type of diseases we have and their peculiarities. So the government should be able to also fund cancer. So in summary, prevention, early detection, prompt treatment, and prompt treatment saves life, and it also saves cost. And then cancer is not a death sentence, and then we individually and we collectively, we have roles to play towards reducing the burden of cancer in our society. Collective efforts are required to establish and sustain regular and focused population health education, population-based screening, early detection, prompt and adequate treatment. This, if instituted on a wide scale level, will help to reduce the burden of cancer significantly in our community. I want to thank you very much for all your time and efforts towards making this program successful, and for the audience who have been patiently listening to us despite the other schedules they have. I also want to thank all my colleagues and resource persons who, despite their tight schedules, they took the risk to travel down and also leave what they are doing to come down to be able to educate us on cancer. No amount of money can ever compensate or pay you for the effort. I also want to thank the representative of the Nigeria Cancer Society, that's Dr. Ishakulawo, for staying patiently from beginning till end and showing passion about trying to help to promote the awareness in our community. We hope that this is the beginning of collaboration at this level, and we'll continue to partner towards helping cancer patients generally. To the main organizing body that brought all of us together, that's the MESH, under the Nigeria Supreme Council for Islamic Affairs, under the leadership of Haja Khadija and able assistant barrister Amasa, for all the work you've done towards making sure this program was successful. I want to thank you very much for all your effort. All the sister organizations, unfortunately I don't have them on my memory, and I don't want to mention one and be biased towards not mentioning the other ones. Thank you very much for your effort, those that contributed ideas and even criticism, all of them help towards making this program a great deal. We wish and we hope that next year we will not just come and have a repeat of this same lecture in another venue, but we wish we will have seen a lot of action towards cancer screening, prevention and some other things, and we wish maybe we'll have come and knocked at the door of the Nigerian Cancer Society and we have taken a lot of intervention. I also want to appeal to them that we are ready for collaborations and support. If there are opportunities for our members to go and get training or even see what's happening there, please and please don't shy away from inviting us. Thank you very much once again. I would like to invite Hajia Khadija to come to give us the closing remark, and thank you very much. I finished my session. Thank you very much. Assalamu alaikum.
I say a very big jazakumullah khairan for all of you staying with us this morning up to now. I think it has been impactful, and that's what we need. We have known the next step to go. We don't need to come and sit and talk. We need actions. What are the actions that are going to follow this? And inshallah, Mesh is going to take the lead, taking all organizations, what we need to do. We should move more than dawah. We should take the health of our members seriously. Cancer is there, HIV is there, tuberculosis, malaria. We have lots to do and to control. Pray Allah subhanahu wa ta'ala help us in this objective. All organizations, Sisters of Jannah, MSSN, NASFAT, Ansarudin, Women in Dawah, our host, the National Mosque Foundation, I say a very big thank you for all of you. This is our objective. The last time we had the breast cancer week last year, so I was thinking we should do something as a Muslim community. Alhamdulillah, this is the beginning, and we think we have more to do. Fortunately, our leaders have gone, but through Mesh, we are going to still work more on more collaborations. The MSSS Secretary General will say a very big thank you, sir, for joining us all the way from Mina. Please pardon us if you have done anything you don't like. This is the beginning, and we hope that we will do better next time, inshallah. I say a very big thank you to all of you. Inshallah, we're going to meet next year. It might not be this, but inshallah, on cancer, on HIV, you are all going to be hearing from me. I hope all of you and your organizations are ready to work. We need to make our health serious. We need to seriously work. Then how are we going to also work to support those who are already down on cancer? That's another big issue for us. It takes millions, but if you support them one way or the other, morally, financially, it's going to be really, really good. So I say a very big thank you for all of you. Thank you so much for coming. We meet again next year, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
كصومي صلاتي به العمر طاب حجابي حياتي أحب الحجاب كصومي صلاتي به العمر طاب حجاب ارتديت فكنت الأميرة بدربي مشيت كشمس منيرة حجاب ارتديت فكنت الأميرة بدربي مشيت كشمس منيرة حجابي حياتي أحب الحجاب كصومي صلاتي به العمر طاب أتوا هنؤوني نجوم كثيرة ومن عتبوني يموتون غيرا أتوا هنؤوني نجوم كثيرة ومن عتبوني يموتون غيرا حجابي حياتي أحب الحجاب كصومي